As Hong Kong enters its peak influenza season, some experts say the situation might be dire if kids get infected with multiple viruses at the same time. An expert recommended that children should receive flu shots to avoid developing serious symptoms. Veronica Lin tells us more.
With the lifting of the mask mandate, influenza cases have been on the rise. Dr. Mike Kwan, Honorary Clinical Associate Professor of Pediatrics and Adolescent Medicine at the University of Hong Kong, says the outbreak was expected and will last around 3 months. However, a point of concern would be when someone is affected with 2 or more viruses at the same time.
Kwan
says the combination of viruses, such as COVID and influenza A, is called a twindemic. It's a worrying mix if these 2 are then combined with the syncytial virus, forming a tridemic. Kwan adds that this strain of influenza A is accompanied by bowel irritability, with symptoms including vomiting, diarrhea, and so on. It mostly affects kids aged 2 to 3. He wants children and those with chronic illnesses to get a flu shot as soon as possible and warns parents to not let their guard down. He adds that most have been focusing on getting their COVID vaccine and not the flu shot. He also found that kids who have not received a flu shot had a higher chance of experiencing severe complications from the virus. Meanwhile, Siu Lam Hospital earlier announced several patients in its ward for males with intellectual disabilities had been infected with influenza A. Another 6 patients in the ward, aged 48 to 71, have shown respiratory symptoms and have all tested positive. They are to receive treatment in isolation. Veronica Lin, TVB News.